Hi, I'm Cathy Turner. I work at the John Walton Muscular Dystrophy Research Centre at Newcastle University, but I also work very closely with the TREAT-NMD Advisory Committee for Therapeutics, otherwise known as TACT. TACT was set up 15 years ago in order to offer advice to companies and to academic groups that were working in the rare neuromuscular disease therapy development space. It was felt that clinical trials were sometimes failing, or compounds were failing to get into clinical trials in the first place because of a lack of access to the very best advice and expertise. So TACT was set up in order to bring together that advice and expertise from around the world to provide input to better position clinical trial programs on a path to hopeful success. The way that TACT works is we have a core committee of experts across the range of expertise required to run a good clinical trial. We have preclinical experts, we have toxicologists, statisticians, regulatory experts, physiotherapists, clinicians, and importantly, patient representatives that we call upon as needed to make up a bespoke panel to offer advice to companies or academic groups who have a compound that they want to take into clinical trial, or a clinical trial that they've already planned, or if they want to move from phase 1, for example, into phase 2 or beyond. A company or an academic group can contact TACT with an initial outline for an area where they would like advice. The TACT Core Committee, which is chaired by Professor Annemieke Arts-Maroes at Leiden University Medical Centre in the Netherlands, take a look at that initial outline and let the applicant know whether or not they feel that TACT can help. In most cases, the answer is yes, TACT can help, and based on that, the applicant is invited to put together a full application containing the preclinical data they have, the questions they have that they would like advice on, their current clinical trial plans if they have them already, and a whole host of other information that is contained in a TACT application form. This, of course, is done under strict confidentiality disclosure agreement, and we also check for any conflicts of interest with our panel. Depending on the questions that are asked and the disease area and the mechanism of action and so on, and the stage at which that pipeline is, we add to our core panel with additional expertise as required to make sure that we are in a position to offer the very best advice to that applicant. Once the application is received, it's reviewed by that bespoke panel, who may come back to the applicant with some additional questions or requests for clarifications or additional data, for example. And after a period of 6 weeks of that review process, the applicant is invited to a face-to-face meeting where they sit round the table with that panel and discuss their application for advice. They can present additional data that they may have, and they answer questions from the panel to make sure that they have all the information they need to give the best advice that will be useful to the applicant for moving forwards. At that face-to-face meeting, which lasts an hour and a half, there is no advice given, but after the meeting the discussion continues. The applicant leaves and the discussion continues between the panelists, and within 4 to 6 weeks of that face-to-face meeting, a comprehensive, confidential and detailed report responding to the questions from the applicant, as well as offering additional advice on how to improve the plans, and giving advice on additional data that may be required, for example, additional steps. There may be questions about inclusion and exclusion criteria on patient cohorts, additional statistical analyses that might be required, a whole host of vital advice for the applicant is put together in a confidential report that's provided to the applicant. That is for them to do with what they wish. We don't ever share that report with anybody. but we ask that if the applicant chooses to share it, for example, with potential funders in the future or potential partners, they do so in its entirety. If anyone's interested in applying for a TACT advisory review, they can contact TREAT-NMD. We run 2 review rounds a year. They tend to be one in Europe and one in North America. And each review meeting can assess up to or offer advice on up to 4 applications at any one time. It's open to academic groups, it's open to anyone in industry, small biotech, large pharma. You can visit the TACT website via the TREAT-NMD website to have a look and see who's been to TACT previously, the kinds of areas we've offered advice, and the disease areas that we cover. The TACT model has been so successful that the European Joint Partnership recently funded a project to set up a TACT model toolkit, which has allowed people working in other disease areas to set up a similar model for their clinical research pipelines too. There's already a TACT model that exists for rare brain cancer, and there are others in the pipeline as well.